Are you scratching your head trying to figure out the maze of Medicare supplement plans? Do you find yourself questioning whether or not they're even worth it anymore?
What a waste of money.
Or should you just jump ship and go to a Medicare Advantage plan instead? If these are the questions keeping you up at night, make sure you stay tuned because you're in the right place. Keep in mind throughout the video that we will use the term Medicare Supplement and Medigap to refer to the exact same thing. So with that out of the way, in this video, we will break down the pros and cons of Medigap plans, discussing how to navigate around the downsides, and to help figure out if these plans might be right or even wrong for you. Stick with us, and by the end of this episode, you'll be well equipped to make an informed decision about your Medigap coverage. But first, we want to remind you that you can actually register for our free online course that includes every Medicare topic we could think of and you can probably think of, and you can learn at your own pace. You can go to this course at gmedcourse.com and you can register in the description below. So what exactly are Medigap plans? Well, as the name suggests, they are designed to fill the gaps left behind by original Medicare. They are sold by private insurance companies, and depending on the plan letter, they help cover some or all of the 20% cost sharing not covered by original Medicare. Simply put, they are there to supplement your original Medicare benefits. Now, how do they actually work? Thankfully, it's pretty simple. Medigap plans, they are secondary to original Medicare, and they kick in when Medicare Part A and or Part B have paid their share of Medicare-approved healthcare cost. These plans, they may cover expenses such as deductibles, co-payments, co-insurance, and they provide you with comprehensive coverage. They also allow policyholders to see any provider that accepts original Medicare around the country, and prior authorization is rarely a requirement. Medigap plans come with numerous benefits. For instance, they may have higher monthly premiums, but they might have lower potential medical out-of-pocket costs when compared to a Medicare Advantage plan. In many cases, they're also quite flexible. Again, they allow you to see any provider that takes original Medicare, regardless of their location. However, they do have some real limitations. Medigap plans, they usually do not cover extra benefits, which are not covered by original Medicare. These might be things like routine dental, vision, hearing, and more. And also to having a likely higher monthly premium compared to Medicare Advantage plans, it is very important to understand that their monthly premiums with Medigap plans, they will increase over time. Currently, there are 10 standardized Medigap plans available for most consumers, and these range from A to N. You can see here on the chart used by the Medicare and You Handbook that each plan will have different levels of coverage based on their plan letter. This can seem overwhelming, but among the various Medigap plans available, Plan G and Plan N have become by far the most popular in recent years. Plan G covers the cost for all Medicare-approved procedures except the Part B deductible, which for 2023 is $226, and just expect that this will usually fluctuate every year by several dollars, or maybe even more than that. While Plan N, on the other hand, it covers all but the Part B deductible, which is the same as with Plan G, and you may have co-payments for doctor's office visits or emergency room visits depending on a couple different criteria. Also, Medigap Plan N does not cover Part B excess charges. Both plans, they offer a good balance between affordable premiums and out-of-pocket costs, but we discussed the differences with these two plans in much more detail in past and future videos, so make sure you check those out. In summary, Medigap plans provide an excellent way to manage and predict healthcare costs, but it is still essential to understand the benefits and limitations of Medigap coverage to make an informed decision. Stay tuned as we explore the potential downsides of these plans and how to navigate these downsides effectively. We are not here to say that Medigap plans are perfect and right for everyone, because guess what? They are simply not. Despite the many benefits of Medigap plans, it's crucial to be aware of their limitations as well. So let's delve into the negatives so you can get the complete picture. First, while Medigap plans help fill gaps left by original Medicare, except for a couple specific scenarios, they only cover medical services that are also covered by original Medicare, which again is Part A and Part B. This means things like routine physicals as well as routine dental, vision, and hearing care, and certain other benefits are generally not going to be covered by Medicare or by your Medigap policy, because again, they're not covered by Medicare and your Medigap policy is secondary. Of course, there might be exceptions to this, but this does hold true for a majority of plans. Secondly, Medigap plans, they tend to have higher premiums compared to Medicare Advantage plans, and these premiums continue to increase over time. Rising healthcare costs are a reality, and unfortunately, there is no escaping this trend. The third negative is related to prescription drug coverage. Current Medigap policies, they do not include Part D prescription drug coverage built into the plan. So to get coverage, you'll need to purchase a separate Part D prescription drug plan, which does come with an additional monthly premium. So while this provides flexibility and you can choose your own Part D plan that suits your needs, of course, it comes with an added cost you have to consider. Finally, Medigap plans offer limited flexibility when it comes to changing plans. In most states, after your Medigap open enrollment period ends and outside of guaranteed issue scenarios, you'll need to qualify medically to change to a different Medigap plan in the future. This means going through underwriting, which basically means answering health questions with a new Medigap policy that you are applying for. So based on your health status, you could be denied for or charge more for a new plan that you are applying for. We will link in the description below to a guide that highlights the states with unique Medigap underwriting rules so you can check if they apply to you. But don't let these negatives discourage you. They're important to consider and to remember, but every health plan has pros and cons. The key is to understand them fully and make an informed decision, which of course is what we will help you with. Let's explore some strategies to overcome these potential challenges. First, to tackle the fact that Medigap plans tend to lack those additional coverages or extra benefits we talked about, not covered by original Medicare, you could simply consider adding additional insurance policies for these services. Even if your Medigap plan does not offer a package of dental, vision, and hearing for their Medigap members, you still have access to purchasing individual dental, vision, and hearing insurance for these services, just like any other adult would have access to typically. You may also want to check to see if your Medigap insurance company does provide extra coverage beyond the typical standardized benefits. For example, there are Medigap companies out there that provide additional coverage options for even things like routine physicals, dental, vision and hearing, and even gym memberships. This may or may not come with an added monthly premium, so just make sure you check on your specific plan. Remember, while Medigap plans are standardized based on their plan letter, that only applies to the basic coverage details that you'll see on that chart we talked about in the Medicare and You handbook. Medigap insurance companies, they can certainly choose to include extra benefits or benefits above what is required based on those standardized benefits. We have already mentioned that Medigap plans typically have higher monthly premiums than Medicare Advantage plans, and really to overcome that downside, you have to understand this is simply going to be a fact when it comes to comparing the two options. According to the Kaiser Family Foundation, the national average Medicare Advantage premium was $18 per month, while 69% of Medicare Advantage members were enrolled in a plan with $0 per month premiums in 2022. Just remember that Medicare Advantage members, they are still required to pay their monthly Part B premium, just like a Medigap member would have to. Now compare those Medicare Advantage premiums to Medigap premiums here in Michigan as an example, where a 65-year-old enrolling in a Medigap plan might pay about $100 to $130 per month for the most popular Medigap plans on the market. And I would say that our state, as far as Medigap prices go, is slightly below average when looking at national Medigap premiums, if not just right in the middle. To come to terms with this reality, you have to remember Medigap plans provide fundamentally different coverage than Medicare Advantage plans. They really cannot be compared side by side, so neither can their premiums. Generally, Medigap plans provide comprehensive medical coverage, and with that comes higher monthly premiums. So now we'll shift to preparing for increasing Medigap premiums. Remember, the lowest cost Medigap plan today, it might not necessarily be the cheapest in the long term. So don't just go with the cheapest plan in the first place. Instead, work with a good insurance broker who can help you understand the cost implications of a Medigap plan over time. Unfortunately, increasing premiums, they are simply a way of life with Medigap plans. Instead of trying to completely avoid them, along with the help of a broker, you should instead strive to keep future increases as low as possible. This is certainly never a guarantee, but of course we suggest selecting a Medigap company or even a Medigap plan letter with a lesser history of increases. Make sure to watch our other videos about Plan G and Plan N, as well as about how Medigap premiums increase for more details about this, but just know, generally speaking, larger insurance companies with more Medigap enrollment and a longer history of being in the market might have more stable premiums over time. Also, in recent years, Plan N has been seeing lower premium increases on average than Plan G, and we typically recommend either Plan G or Plan N when it comes to long-term increases, especially when compared to Plan F. Also, if you are eligible to change to a new Medigap plan in the future, consider doing so every few years to keep your monthly premiums as low as possible. Again, that will come down to your health at the time when applying for a new plan. Now shifting to prescription drug coverage, when it comes to managing separate prescription coverage, it is important to remember you're not limited to choosing Part D plans that match your Medigap insurance company, so you don't have to have the exact same insurance company providing both coverages. Use Medicare.gov or again work with a broker to find a Part D plan with the lowest overall cost for your specific prescriptions, and don't worry about the insurance company's name that is providing the plan. Separate Part D coverage, it can be a benefit since you can shop and change your Part D coverage every year without changing your Medigap plan. This can be done during the fall annual election period from October 15th until December 7th. We even have another video that shows you how to find a new Part D plan using Medicare.gov's Plan Finder. Typically, the popular Part D plans change every couple of years, so don't get caught keeping the same plan for many years only to realize you're wasting money. And lastly, let's address the issue of possibly not being able to change your Medigap coverage in the future. So when choosing your Medigap plan, make sure you understand that your Medigap open enrollment period, which is the period that lasts for 6 months, beginning the first day of the month you are both 65 or older and enrolled in Medicare Part B for the first time. During this period, you can purchase any Medigap plan without health questions or being charged more based on your health status. Use this time wisely to find the right Medigap plan that you are comfortable with for many years to come, instead of just considering the next couple of years. Even if you are healthy in the future and you can switch plans, it's better to go into your Medigap open enrollment period with the mindset that you won't be able to do so. In the description below, we will of course link to the official Choosing a Medigap Policy Guidebook, which is published by CMS, so that you can learn more about the details of your Medigap open enrollment period. In addition to maximizing your Medigap open enrollment period, you should also take time to understand your state's unique requirements for changing Medigap plans in the future. Although Medicare is a federal program, specific Medigap rules and regulations, like how you can change plans, these are actually governed by individual states. So in about 12 states, you may be able to change Medigap coverage after your open enrollment period, regardless of your health. We won't get into specifics in this video since it's a lot to talk about, but here is a map of states with current and upcoming unique rules for changing Medigap coverage, and it simply seems like more states are getting added to this list every single year. Also, as we mentioned, we will of course link to that specific state Medigap underwriting guide in the description below. While Medigap plans have their negatives, as we discussed, with the right strategies in place, you can navigate these challenges effectively. Next, we will explore who Medigap plans might be right or wrong for, so stay tuned. We've explored the downsides and the strategies to overcome them. Now let's shift gears and highlight the benefits of Medigap plans and what makes them a strong contender for your Medicare coverage option. Like we mentioned, Medigap policyholders enjoy the freedom to see any provider that accepts original Medicare without network restrictions, as long as the provider is willing to see you as a patient, of course. This benefit is particularly valuable for those who travel frequently around the country or who have a number of specific doctors or facilities they want to make sure they are able to see in the future. Second, Medigap plans, they offer low out-of-pocket medical costs. So unlike with health insurance you might have had in the past before you started Medicare, the majority of your healthcare costs are covered when combining original Medicare and Medigap coverage. And you're left with minimal out-of-pocket medical expenses, which is especially true with the popular plans, which are Plan G and Plan N, like we mentioned. Next, Medigap plans, they rarely require require prior authorization for services. Prior authorization is often thought of as prior approval, and according to healthcare.gov, this is when your health insurance or plan may require pre-authorization for certain services before you receive them. So luckily, with Original Medicare, it is very, very rare that it requires prior authorization before medical treatments, and because Medigap coverage is simply secondary to Medicare, it does not have any say on what can or cannot be covered or whether or not prior authorization is required. This can make managing your healthcare more simple and less stressful, ensuring you get the care you need when you need it. Now, fourth, one of the key benefits of Medigap plans is they are guaranteed renewable. So as long as you pay your premiums, your coverage will continue. Unlike yearly contracts, this gives you long-term peace of mind, knowing that your coverage will be there for many years to come. And finally, while Medigap premiums can and will increase over time, these increases are at least based on the cost of healthcare for all individuals enrolled in the same Medigap plan in your state.
You're taking you down with me.
This means you won't be singled out for higher increases even if you have more medical issues than the other people enrolled in the plan with you. These benefits make Medigap plans a solid choice for many people. However, they might not be right for everyone, so it's only fair to discuss who might benefit from Medigap coverage and who might not. So now that we have a clear understanding of Medigap plans and the benefits and the downsides, let's now dive into who might be ideal candidates for these plans and who might benefit less. But of course, we want to mention a quick disclaimer that these are only our opinions and they should not be used as strict guidelines for who should or who should not get Medigap coverage. Of course, don't make the decision until you consult with an independent broker based on your specific circumstances and budget. So if you are a snowbird, which is of course very popular in Michigan,
why can't I try life as a snowbird?
Or if you travel frequently, Medigap plans could be right for you since it allows you to see any provider that accepts Original Medicare across the country. They're also a good fit for those who prefer limiting prior authorization for medical services. Also, if you know you will have large medical expenses due to your current health, or if you simply want to protect against potentially higher medical costs in the future, and you can afford those higher premiums with a Medigap plan, it might also be a very good option for you. Lastly, if you place a low priority on extra benefits like dental, vision, hearing, and gym memberships, Medigap coverage could of course be an excellent option to consider. Now on the flip side, Medigap plans might not be right for everybody. So suppose you're okay with network restrictions and prior authorization and potentially having those higher out-of-pocket medical costs in exchange for lower premiums and extra benefits not covered by Original Medicare. In that case, you may want to seriously consider Medicare Advantage plans. Similarly, people with Medicaid or certain retiree coverages like TRICARE for Life will likely not benefit from Medigap coverage. If you value extra benefits not covered by Original Medicare, or you cannot qualify for a Medigap policy based on your health, or it's simply not affordable, Medigap coverage might not be for you, and you should take time again to seriously consider Medicare Advantage plans. Regardless, everyone should consider a Medicare Advantage plan versus a Medigap plan when you are first eligible. No matter what your budget or what your preconceived notions are about the coverage options that might be right for you, we recommend everyone that makes their transition to Medicare should consider actual Medicare Supplement coverage versus Medicare Advantage options, and make sure you're looking at plans that are available in your specific geographic region to find out what might work for you. Don't start this decision process hyper-focused on one option just because of videos you see on social media. Even this video. It's not about labeling Medigap plans good or bad, but rather understanding how well they align with your specific healthcare needs, your lifestyle, your budget, and always take a long-term view when it comes to your health insurance coverage. What might seem right today, it simply might not necessarily hold true for your future self.